In order to succeed in reducing youth substance use and improve health, safety, and quality of life, the Stratford Partnership relies on survey data that is collected every 2 years from a sample of middle and high school students around attitudes and behaviors. This allows us to monitor trends and emerging issues around substance use and other risky behaviors, as well as protective factors and youth assets, and plan the most beneficial activities and programs. Overall trends indicate that Stratford youth are making healthier and safer choices.
Reducing the rates of past 30-day use of a substance is one of the most important indicators of meeting prevention goals. Here we see that there are significant decreases in alcohol and cigarette use among Stratford teens. Since 1998, reported alcohol use has decreased 48% and cigarette use 86%. Since we began collecting 30-day use of marijuana in 2011, reported rates have also decreased from 16% to 14%.
When we compare Stratford rates to teens in CT and around the country, we see that reported cigarette use rates among Stratford high school students are lower, marijuana use rates are the same, and alcohol use rates are slightly higher.
The partnership pays close attention to reported binge drinking rates. Binge drinking, defined on the survey as having 5 or more drinks in a row, is the dangerous and high-risk behavior that impairs judgment and opens the door for serious consequences such as sexual assault or alcohol poisoning. We are encouraged that binge drinking rates are also decreasing.
The partnership also monitors use rates of other drugs, including use of prescription drugs without a prescription and heroin. Use of pain relievers, tranquilizers, and stimulants, all without a prescription, were reported by less than 3% of all high school students.
More good news. In 2018, reported rates around driving after drinking, riding with the driver who had been drinking, gambling, having sexual intercourse, skipping school, and hitting someone all decreased.
However, the partnership is concerned about the increasing reports of depression, also a trend in Connecticut and in the U.S. Mental health issues are often intertwined with substance abuse disorders. Students who reported feeling sad or depressed have increased 35% since 1998 and had significantly higher substance use rates for alcohol, marijuana, cigarettes, and prescription drugs.
In 2018, 23% of high school students reported using an e-cig to vape nicotine, and 12% reported vaping THC or marijuana. Youth have easy access to e-cigs, as well as believing that they are harmless. We are working with the public schools to make students aware that the long-term effects are unknown, essentially making our generation the guinea pigs. A 4-minute video, What You Should Know About Vaping, was sent by the superintendent to families of all middle and high school students. Our school resource officers are important partners in addressing this public health crisis by informing students about the dangers of vaping and confiscating vaping devices from students who are in possession on school property.
Regular compliance checks conducted by the police department are critical to reducing access to tobacco, vaping products, and alcohol. In the past 2 years, over 6 checks have been conducted in our community.
In 2018, close to 1 in 3 high school students reported that they drank alcohol in the past month, 31%, and 17% of high school students report binge drinking in the past 2 weeks. In addition to compliance check operators, police officers distributed counter mats created and printed by CT distributors to liquor merchants to remind adults at the point of sale to not provide alcohol to minors.
Additionally, 1 in 5 high school students agree that it is okay to drive if you smoke marijuana. The partnership keeps an eye on perception of harm reported by youth. As more states legalize marijuana for adult social use, youth increasingly believe that it must be safe for them as well. However, the introduction of a mind-altering substance such as marijuana to the developing adolescent brain is never safe. 90% of addictions start in the teen years.
The Stratford Police Department conducts regular park patrols in known hotspots throughout Stratford. These are very effective in keeping our parks family-friendly and reducing youth substance use.
According to the Centers for Disease Control, more Americans now die every year from drug overdoses than they do in motor vehicle crashes. And sadly, we know this is painfully true. In 2017, 14 Stratford adults died from an overdose. In partnership with the Health and Fire Departments, free overdose prevention and Narcan administration workshops are offered. CARE's Hope and Support Group for those with a loved one struggling with substance abuse disorder meets every Monday at the Stratford United Methodist Church.
Additionally, the Stratford Police Department has been able to remove over 1,000 pounds of excess, unused, or expired medications from homes annually through the medication drop box. In 2017, there were 1,038 pounds of medication collected. There have been 926.4 pounds collected from 2018 to March of 2019.
To recap, there's a lot of good news. Prevention science makes it clear that if we want to prevent a problem before it happens, we need to continually address and reduce risk factors while increasing protective factors. We can save lives and money only if we continue to invest in evidence-based prevention. A big thanks to the Stratford Police Department for being a great prevention partner. This good news is only possible with your support and efforts.
For more information and the complete results from the Search Institute Student Survey, please visit our website.